wanted to talk a little bit about botulinum toxin as well, because that can be really useful for synkinesis. So this lady here, she had facial therapy and botulinum toxin for her synkinesis. So what we do is we inject it into key areas of the synkinesis, and that might be a doctor or a therapist that does the injections. And it works because it reduces these overactive muscles back down to a more normal level. So basically it quietens down the noisy muscles, and it allows you this window of opportunity to work on relearning really precise coordinated movements the correct way, whilst the muscles that were opposing that movement are quieter for a few months. Sometimes if the other side is overactive, they might give some injections on there as well, but we tend to try and leave the unaffected side alone so that we can use it as our template for learning. We don't want to mess around with that template too much. And you shouldn't be having injections if you haven't had specialist facial therapy. The injections cannot reprogram your brain with the correct address of the muscles. They can't retrain your brain about how to move your face properly. And they can't train your brain about how to quieten down the synkinetic movements for long-term recovery. And it's certainly the injections can't stretch out the short, stiff, tight muscles.